Healthcare costs in Singapore can be overwhelming. If you're not prepared, they can drain your savings faster than you think. But what if I told you there's a system already in place to help you manage medical expenses, one that ensures you have enough set aside for hospital bills, insurance, and even long-term care? That's where your MediSave account comes in. Today, we are going to break down exactly how MediSave works, what you can use it for, how much you can contribute, and what happens if you don't use it. By the end of this video, you'll know how to maximize your MediSave and take control of your healthcare costs. Hi, I'm Fer from Dollar Bureau, a personal finance platform that talks about insurance, investments, and financial planning. Okay, first things first, what is your MediSave? The MediSave is a compulsory medical savings account under the CPF system. A portion of your salary goes into this account every single month, specifically to cover healthcare expenses. It's not just like any other extra savings, it's actually designed to help you pay for essential healthcare costs, including hospital bills, outpatient treatments, health insurance premiums, and even long-term care. But how exactly does MediSave work in real-life situations? Let's go over what you can actually use it for. Firstly, hospital bills and inpatient care. If you have ever been hospitalized, you know how quickly the bills can add up. MediSave helps cover daily ward charges, surgical procedures, and psychiatric inpatient treatment. For example, if you undergo a knee surgery that costs $5,000, MediSave can cover a significant portion of that bill, reducing your out-of-pocket expenses. While MediSave is helpful for hospital stays, it's not just for inpatient care. It can also be used for outpatient treatments, which are equally important in managing long-term health. Many chronic conditions require regular treatments and checkups, and that's where MediSave can also help. It covers treatments for chronic conditions like diabetes and hypertension, vaccinations such as flu shots and vaccines, health screenings like mammograms and colonoscopies, and medical scans such as MRI, CT scans, and ultrasound. One of the biggest advantages is that you can use MediSave to stay on top of preventive care. Catching health issues early means lower treatment costs in the long run. But what if you want additional financial protection? That's where MediSave also comes in handy for insurance. So your MediSave account can be used to pay for essential health insurance plans, including your MediShield Life, your Integrated Shield plans for private hospital coverage, and long-term disability insurance such as ElderShield and CareShield Life. Speaking of long-term needs, let's talk about how MediSave can support you or your loved ones when long-term care is required. If you or a loved one needs long-term care, MediSave can help with home nursing, rehabilitation services, and palliative care. There's also the MediSave Care Scheme, which allows those with severe disabilities to withdraw up to $200 per month to support their care needs. This can be huge relief for families managing the cost of elder care or disability support. But what about families preparing for a new child? Don't worry, MediSave has provisions for that too. For parents, MediSave helps cover pre-delivery expenses such as ultrasounds and doctor consultations, hospital delivery costs for both natural birth and C-sections, and the MediSave grant for newborns, where every Singaporean baby gets about $4,000 in their MediSave account to help with future healthcare expenses. This makes it much easier for parents to manage medical costs during pregnancy and early childhood. But how much can you actually withdraw from MediSave for all these expenses? Okay, let's go over the limits. While MediSave covers a wide range of healthcare expenses, there are limits and sublimits on how much you can withdraw. For hospital stays, you can use up to $550 per day for the first 2 nights and $400 per day after that. For surgeries, you can withdraw up to $300 per day. And if you're managing a chronic disease, you can use up to $500 to $700 per year for treatments. Chemotherapy patients can withdraw up to 1.2K per month, and psychiatric patients can use up to $5,000 per year. These limits ensure that your MediSave funds last for your future medical needs. Now, let's talk about where these contributions to your MediSave account comes from. If you're employed, a portion of your salary is automatically allocated to your CPF contributions. The percentage depends on your age, with younger employees contributing about 21% of their CPF savings and older employees contributing a higher percentage as healthcare needs increase with age. Well, if you are a self-employed and earning more than $6,000 per year, you're required to contribute to MediSave as well. These contributions help ensure that everyone has a dedicated fund for healthcare expenses. Now, what happens if your MediSave account grows beyond what you actually need? While there's no minimum amount required, there's a maximum limit called the Basic Healthcare Sum, also known as the BHS. In 2025, it's currently set at 75.5k, and once you reach that amount, any excess are transferred to your special account or retirement account. This way, your savings continue to work for you, whether for healthcare needs or for retirement planning. But what if you never use your MediSave savings at all? If you don't use your MediSave funds, they continue to grow at an interest rate of 4% per year. Additionally, the first 60k of your combined CPF balances earns an extra 1% interest, meaning you could be getting up to 5% on some of your MediSave savings. Even if you don't need to use it now, MediSave is still working in the background to grow your healthcare funds for when you do. But in the unfortunate event of death, here's what happens to your remaining balance. Any remaining balance in your MediSave account will first be used to settle any outstanding medical bills. After that, the rest will be distributed to your CPF nominees. If you haven't made a CPF nomination, the funds will be distributed according to Singapore's intestacy laws. I've covered more on CPF nominations in a previous video. I'll link it in the description below somewhere, so be sure to check it out. And that's it. MediSave is one of the most important financial tools for managing healthcare costs in Singapore. It helps you cover medical expenses, pay for insurance premiums, and plan for long-term care, all while ensuring that your savings continue to grow. Knowing how to use it effectively can save you thousands in medical costs while keeping your finances secure. If you want to learn more about how to optimize your MediSave for your specific needs, you can speak with our financial advisors. I'll include a link in the description below. And if you found this video helpful, don't forget to like, share, and subscribe for more practical financial tips. Thanks for watching. I'll see you in the next video.